Namaste and good afternoon. On behalf of Apollo Hospitals, I'm delighted to welcome you to yet another session of our corporate health series. This is Dr. Srinidhi Chidambaram here. The series aims to bring focus on health issues that you, as part of the corporate world, are at particular risk for. We hope that this series helps you to function at the peak of your productivity with minimum stress and maximum well being. Burnout. I'm sure you've heard this term. If you're feeling excessively tired, devoid of energy, demoralized, and irritable, there is a possibility that you may have burnout. The WHO defines it as a feeling of depletion, exhaustion, being mentally distant or cynical about one's job, with reduced competence and effectiveness at work. Stress can lead to burnout, and burnout perpetuates stress. So that's a vicious cycle there. Almost every one of us experiences burnout at some time or the other. It's caused by high stress that continues without a break. It can develop from things like a very demanding job, difficult home life, or caring for someone who's sick. It can cause you to feel sad, hopeless, exhausted, irritable, and lost. We all know that burnout can suck our energy out and make us very irritable, stressed out, stuff on our mental well-being, and you can even get that can even get in the way of success in your career. But job-related burnout is also specifically linked to many health problems, and besides the direct effects, can also cause unhealthy addictions and behaviors. One such outcome is that extreme burnout may hurt your heart literally. A study published in the European Journal of Preventive Cardiology found that burnout can lead to potentially deadly irregular heart rhythm known as atrial fibrillation, which can lead to several other complications. So it's important to address this issue. So today we have this session which focuses on how we beat the effects of burnout on the heart. So we present Beating Cardiac Burnout, and this is also going to be a healthy heart guide to employees of the corporate world. And to discuss this and give his valuable inputs, I am delighted to welcome Dr. Deepesh Venkatraman. Dr. Deepesh Venkatraman DM Cardiology has been working as a senior consultant in interventional cardiology at Apollo Hospitals, Chennai, for the past 5 years. With over a decade in the field, he specializes in interventional cardiology, handling procedures from routine angioplasty to complex interventions for peripheral vascular disease, aortic disease, pacemakers, device therapy for arrhythmia and heart failure. Having received a gold medal during MD and recognized as a top 5 cardiology fellow by TYSA, his accolades extend to various awards. Dr. Deepesh is notably dedicated to management of end-stage heart failure, offering solutions like mechanical circulatory support and heart transplantation. His professional commitment extends to preventive cardiology, which is evidenced by his active involvement in academic and community programs aimed at spreading awareness. Additionally, he is currently engaged in research focusing on artificial intelligence in preventive cardiology. Dr. Deepesh, welcome to our corporate health series. Thank you so much for joining us.
Namaste. Happy to be here.
So, cardiac burnout. This is an interesting term, but I just wanted to begin by asking you if this is a scientific term or is it just a term that we use to refer to the effects on the heart caused by stress and burnout?
Yeah, so there is no medical term called cardiac burnout, and but the effect of burnout in the literal language sense makes it feel that it has reached the end of its potential, as you alluded in your opening remarks, the depletion of the energy. The same way, the heart is a mechanical pump, and it helps to circulate blood throughout the body, and it needs energy as well as oxygen to kind of process it as a fuel, and hence function well. So the moment this fuel is not supplied to the individual cells of the heart starts taking a toll on it, and we see various health conditions of the heart like heart attacks, heart failure, arrhythmias, all of it as a result of this impact of lack of blood supply to the heart. So I would say depletion of energy due to various reasons can lead to a heart reaching a stage where it starts developing one of these health conditions. So that's why we need to focus on cardiac burnout as a very important entity.
So, since we know that it is stress and burnout that could cause all these cardiac abnormalities, what would be typically examples? Because today our life is full of deadlines and stress. So, what distinguishes a particular stress or burnout that could affect one's health? And how do you distinguish it really from everyday travails that we all have?
So, in fact, speaking on that, I would say many of these health conditions, so called lifestyle diseases, are all related to the stress that we see. The stress is not just restricted to the workplace, it's also there in their personal life. But the stress, in overall sense, are the responsible factors for the lifestyle diseases, to the extent that we are seeing the onset and rapid growth of lifestyle diseases in younger population in nowadays, and that's something which is very alarming, and that's probably the reason we as cardiologists are trying to reach out more via all the mediums that's possible to educate people that don't consider heart problems and the risk factors of heart problems like hypertension, diabetes, or a sedentary lifestyle leading to obesity or obstructive sleep apneas as a condition of old age. Maybe it used to be a post 55 age group health condition, but now we are seeing it growingly among people in the age groups of beyond 20, and definitely among about 35, many are having health conditions. So I think it has to be seen that we have to recognize it early, and all these lifestyle diseases which I just mentioned are probably in some way a result of our stress and the burnout which our system takes in.
So, since the stress and burnout is so important, what would be the early warning signs? What should one recognize as warning signs that you need to do something?
And many of us in our day-to-day life feel a sense of fatigue, a early fatigability, unlike the teenagers and maybe the pre-teen age group where people are always full of enthusiasm. You feel a sense of fatigue. You feel a sense of amotivation, demotivation to kind of looking forward to life. And these might be an early sign that somewhere your system is taking a toll. You also notice that the previously easily accomplished activities like climbing 3 flights of stairs or maybe going for a brisk walk was a very easy activity, but now it comes with a sense of panting at the end of the work. So these subtle signs of fatigue, breathlessness can be a thing which you should take note of and also take action on to find out why should it be that a person is developing these kind of symptoms. Many a times these can be identified and linked to a root cause, and once identified and linked and treated, you can get your energy back, and it would rejuvenate you to enjoy your life much better.
Unfortunately, when somebody is undergoing stress, they also think that they have their own solutions to it. Some of it may not be healthy, and there are quite a few misconceptions about how somebody can manage stress. One example can be like, when they want to meet deadlines, just downing cups of coffee, or it might be resorting to unhealthy addictions. So there are lots of things that people think are helping them, So, what would some of these be, and what would your advice to people be? What should they do if they notice that, there is a sudden dip in their productivity or in their energy?
Mhm. Actually, we are all living in this era of social media and WhatsApp, and our source of information is not restricted to doctors alone nowadays. And we get our information from all the places, and it definitely confuses a lot of us. I would say it is probably a reason why we have developed a lot of myth, and that's something which we need to debunk. I have seen in my practice that people kind of feel that symptoms are the main pointer or a flagging sign for their health condition. So if there is no symptom which at least disables them, then they are not having health condition. And many of them proudly say that since I did not have symptom, I never got myself checked. So I see that that's the first myth that needs to go away, that symptoms are probably the kind of, it takes 80% of the disease to have progressed inside your body before it starts showing up outside. So it's the iceberg phenomena, as we say, that it comes out and surfaces only when the disease has already involved your body in a significant fashion. So if you have to control your health problems at a stage where you can correct it by lifestyle changes, you need to recognize it very early. So when you kind of wait for it to become symptomatic, probably you are already in the stage where medicines are the treatment for your health condition, or some of them have actually even crossed the stage of medicine and they require procedures or surgeries. So while everybody wants to be staying away from medicines, they don't realize that testing and recognizing kind of early fatigue is going to give go a long way in improving their health. So don't wait for symptom is one thing. Apart from that, the social life in general is something that I would say that has got depleted, and social media has taken its place, and that has led to a lot of misinformation as well as as you said, addiction. And that probably the sense of getting instant gratification has led to a lot of these dependence on substance and other areas of instant gratification as well. So I would say instant gratification and the need for it should go away right from your social media to the substance abuse. So that's a second lifestyle change that is very much imperative, because if you are looking for instant result, diet is not going to give you that, exercise is not going to give you that, and hence all those healthy measures are not going to be welcoming for yourself. So moment you go away from the need for instant gratification, you can adopt your healthy lifestyle. So probably these are the first two main myths. The last one which I would like to allude to is people are very scared on starting medications, because they think that once started it would stay for lifelong. The second myth around starting medication is it would have side effects on kidney or some liver or some organ. So I would say that these medicines are all tested and approved after various stages of faring up into the scrutinizing criteria, and they are very, very safe. It definitely is more safe than a pizza or a burger who has not got any approvals from any health authorities. So starting medication is not going to actually help you stay away from problems. It will not only do that, it would also kind of keep you protected for other complications of the health issues.
Right. So, coming to actual cardiac issues, so we would like to know what are the different effects that stress has on the heart.
So we can categorize the effect of stress on the heart into issues which are related to the pumping capacity or the ejection of the blood, and the rhythm issues that comes along with it. So one of the most important thing to realize in terms of the heart's muscle and functioning of the heart is that it needs blood supply, which carries glucose and oxygen. And the blood vessels supplying the muscles of the heart are called coronary arteries. adequate blood supply is required for it to function, say around 70 to 80 times per minute. That's the beating capacity. And a normal pumping capacity is somewhere around 60 to 70%. That is around 100 ml of blood entering the heart. Should 60 to 70 ml should exit the heart by one single pump of the heartbeat. So for doing it in that efficient fashion, blood is definitely required. The problem to blood supply starts because of deposition of something called cholesterol in the blood vessel wall. Not everybody who has cholesterol develops these blockages. There are secondary factors which are also needed to be present for cholesterol to get deposited. Hence, we find that people with very high cholesterol values don't have any health conditions, while people with a normal cholesterol value develop blockages. So there are other factors which needs to be present in for the cholesterol to enter and get deposited in the blood vessel wall. And these factors can be stress, can be diabetes, can be hypertension, can be smoking, can be sleep apnea, like conditions where oxygen supply is less. All of these leads to you can call a small damage to the vessel wall lining, which is otherwise a very smooth and lubricated surface. We call medically endothelial dysfunction. That's the first sign of problems in the vessel wall. So once the dysfunction happens, the cholesterol becomes sticky and it goes and stick to the vessel wall. And once more and more cholesterol gets stuck there, it causes blockages. So this is one type of problem in the blood supply. There is another type of problem called heart attack, in which the blockage is due to clot formation. So unlike the cholesterol related blockage, which kind of grows over many, many years, the clot formation can happen within minutes to hours, and which has to be distinguished from heart blockages because they are very sudden, and they can come in any individual of any age group. Even youngsters at 20s and 25 years of age are getting heart attacks, and people who have actually got treadmill test and other cardiac checkup done can also get heart attacks. So one has to recognize what are the factors that can cause heart attack, which are different from the risk factors for a blockage due to cholesterol. The third kind of impact on the heart, as I said, is due to rhythm issues. The most common being atrial fibrillation, and the heart functions in a rhythmic fashion so that the blood is propelled only forwards. When the heart starts having rhythm issue, that the upper and the lower chamber don't function in synchrony, the blood doesn't manage to cross very easily. It's like a traffic jam, and that's when people start feeling palpitation and breathlessness as symptoms. So these are broadly the main three types of issues of stress causing heart problems.
Right, doctor. So the next question would be about prevention. What can people do apart from, of course, the stress management part? What are the specific aspects of prevention of heart disease?
So knowing and knowledge is, I think, the cornerstone of going towards a healthy heart lifestyle. So one should get their information correctly obtained. They should realize what is a myth versus what is a reality, because while I would probably, in going forward in this particular discussion, we would have more detailed discussion on what are the specific actions that we can take, but people have to realize that there are a lot of other myths that are going around. Some of that has a commercial angle to it as well, and not to believe all the health advices unless cross-checked with the doctors and people with medical knowledge in that specialty. It definitely is linked to diet, exercise, and lifestyle in general. All these three are the major pillars of changes that we can do for prevention of heart problems.
We'll come to each of those in a bit, but I think the foremost advice would be what you rightly said, that to actually see a doctor, which means that you go for a preventive health check and actually come into contact with. But as you said, in this age of social media, what happens is that it is the information just pops into your mobile, and there are all sorts of people on Instagram or on Facebook giving you random and unsubstantiated and often harmful health advice. whereas you're not really in contact with an actual doctor. So I think maybe a good beginning would be that you do schedule an annual health checkup, and then also uh, do all the tests, and also take the advice of your doctor on what to do, your lifestyle. And I think doctors also these days are much more open to sitting and discussing prevention and lifestyle, rather than actually just writing down a few medicines and just giving it to them. So I think
Yes.
people should take advantage of that. In fact, there is a whole specialty called lifestyle medicine now, which some of us have done. So it's all about lifestyle even before we actually start the medications or anything. So I think we will now just touch upon those specific factors that you mentioned. I think in heart health, both diet and exercise are extremely important. But again, these are the most misunderstood areas, because again, there is a host of, there are hundreds of dietitians now, hundreds of gyms, and there are people who are peddling all kinds of supplements and all kinds of quite dicey routes to weight loss. So, what would your suggestion be? And especially when somebody is a professional in the corporate workspace, what happens is that there's also word of mouth. So, somebody has gone to one gym and then they say, why don't you try? So, there's a lot of peer interaction as well. So, what would you advise a corporate employee on what to eat? And of course, it's also not easy when you're working to follow specified diets. So, the temptation to just indulge, order, and eat and all is there. So, when you're traveling on work, so what would your actual advice be on this?
Yeah. So as you said, the diet, it's easy to advise the diet, but then it's difficult to kind of get it ready on time and get those source of food which is not available. Many are actually staying away from their family as bachelors, and they often don't have the advantage to kind of get the food customized to their actual need. But then the broad rules of diet into maintaining the healthy heart would be that weight loss should be one of the major factors. I would say if you can keep your BMIs around 18.5 to 20 would be a very ideal target, even though up to 23 is a range that we call healthy. But the lower end of that range is where you would feel yourself to be the most healthy. So one aim for all of us should be to recognize what's our BMI is and try to kind of reach towards the lower end of the BMI range. How to go about it? The broad rules about diet would be we should go back to the nature. The nature is how the God made us. What was available in the nature is what we are supposed to take. So all these processed and refined foods are actually for our teeth, our taste buds, but not exactly for good for our gut health. So we often regret after having a very good rich meal. We regret the next morning and the whole night it's burning. There is a lot of acid reflux and bloating and all the problems. So stop serving your taste buds and start taking and being mindful about your overall comfort with food. Fruit and vegetables have a lot of quantity of antioxidants, and they, apart from fibers and other nutrients, and I would say they are supposed to be the bulk of our diet. And how to make that tasty or interesting can be something which we can kind of slowly get a taste for. You have to experiment with a lot of options, but including a lot of fruits and vegetables should be the first way to go about it. Secondly, to reduce simple sugars like beverages and the pastry items and all these things which are having a high glycemic index. So one should research on whatever they are having a liking for or they daily consume, which of the foods have high glycemic index, and they should avoid it. The reason for avoiding high glycemic index food is they are very tasty, they are very easy to consume, but what happens is the insulin gets secreted in such high quantities after consuming it, is that it gets processed very fast and you start becoming hungry within next 2 to 3 hours. So you tend to overeat. After that, you start having craving for the next meal. So this tendency to crave for food and eat frequently comes because your food doesn't have the right glycemic index and the fiber content. So avoiding these kind of food items and replacing it with a much more modest and complex carbohydrates like fruits and vegetables, which are mixed with fibers, are going to be very important. Third is achieving a balance in the diet. Like there is a lot of myths that the cholesterol is absolutely bad and stuff like that. But the basic rule is to establish a balance wherein there is good amount of cholesterol, carbohydrate, proteins, and the minerals and fibers. So all these needs to be there in the right quantity. One consultation with a nutritionist might actually go a long way, which are nowadays a part of many of our health checkups in the hospitals. And such a thing would help you in understanding which are your protein sources. Many of us are missing protein sources. And now that our lifespan is increasing and we are all probably going to live more than 70 years of age, maintaining a good muscular body will help a long way in maintaining our mobility and enjoying in life in future. So it's an investment for our future self, that we invest on protein and exercise in a way that our muscles are all preserved. Carbohydrates, last but not the least, cholesterol and fat is something that needs to be cognizant of. You should know how much to take. The deep fried foods and the non-vegetarians avoiding muttons and seafoods like lobsters are to be kind of reduced, and fishes and the other superficially fried food, some oil can be okay. It's not so bad as once used to be believed to take cholesterol, because cholesterol is very much essential for wear and tear of the body, for the growth of our nerve, and all of this helps with the help of cholesterol, which forms the cell wall. So I would say avoid huge quantities of cholesterol in one meal. Take lot of nuts and like walnuts and almonds as a source of cholesterol, and bit of oil is okay for cooking. But deep fried foods have to be avoided. So this is broadly about how to go about diet in terms of maintaining a healthy heart.
And what about the exercise? There again, there are like today options like never before, but a lot of confusion as well.
Yeah. So, with respect to exercise, people have to realize, again, going back to the nature, God made us a mobile creature, and we are supposed to walk and run for our food, which is not the reason why we directly run, but then indirectly we are doing all of it. But sedentary lifestyles have created a reason for us to start joining exercise programs, because we, as a part of our work, are not necessarily required to move around and work around. Otherwise, that probably would have been enough. So, getting around 30 to 40 minutes of exercise in the form of simple walking at a pace which you can actually be comfortable with. So, many people think that either brisk walking or no walking, there is no in between zone. So, I think if you have not been walking around, you should start walking. Maybe start with only 15 minutes of walking a day, is slow stroll. Even elderly people can do that. Take rest in between if needed, but just get into that discipline of walking, and that would be a good starter. Your body will yourself tell you when you need to increase your pace and when the existing pace is not good enough, and listen to your body and start exercising. This is different from people who go for adventure sports, jogging, and there are some people with high intensity exercises, which is becoming a trend nowadays. I would say high intensity exercises and heavy weight lifting, power lifting, all of it should be done by people who are very seasoned. They have been training for it for many months, and on that particular day when you're doing it, you should be healthy. You should not have emotional stress. You should not have had very heavy meals in the previous day. You should not be sick with some cold or fever, and that day you go ahead with such kind of exercises can be counterproductive. So it can be good, or maybe boost some adrenaline and endorphins, positive happy hormones when you do such kind of exercise, but it's not meant for everybody, and it's not the way to maintain a good healthy lifestyle. Your simple walking and simple walking on treadmill, or doing basic weights with in gym, or doing basic yoga, is as good to maintain a healthy lifestyle. There is no need to go very aggressive in terms of exercise, and definitely to be avoided on the days when you are not feeling well or had a very bad day in office.
So, of late, we've also been hearing about people who have been having heart attacks after a gym workout, and people who also sometimes, I think, take a lot of supplements to boost performance. So, what I think the corporate world also will have some employees who fall into this zone. So, what would your advice be to them?
As we discussed, social media and Instagram inspires each of us to not only kind of be good in our work, but also be in a very good presentable shape, and that inspires a lot of the people to start kind of overindulging into these kind of supplements. And many of these supplements are steroid based, because anabolic steroids are very easy way to put on weight and put on the bulk that you need. But these steroid based supplements are something which definitely should be avoided, because the side effects of steroids, with be it hypertension, be it the other adverse effects on kidney and the rhythm issues in the body, and the long term effect of it on the overall fat mass that you gain afterwards, is never going to be well justified when you take it for short term gains. So that's one thing. Beyond that, you have to kind of strike a balance where how much you get influenced by the need for looking beautiful or looking muscular, versus what is healthy for you. And health is what is more important than any of these short-term goals.
Another thing that gets compromised when you're working, and probably if you're also having to manage your family and you have all the stresses, sleep. So, how important is sleep in prevention of heart disease?
I think in the times that we have seen, from the times when we grew up in 80s and 70s to the times that we see currently, working hours have lost its restrictions in a complete sense. Like there is no definite working hours. 8-hour work days are a thing of past. And because of the aspirational nature of people and the mutual peer comparisons, people are trying to create a lifestyle in terms of external and materialized lifestyle, which requires them to work harder. And also, we are now becoming global citizens, and we are trying to support people with outside our boundaries and our country, and that makes us have very erratic work timings as well. So, having said that, sleep is the only time wherein your entire repair work and your regeneration work happens. You would be surprised to know that somebody, if they walk 10,000 steps a day, manages to burn 400 calories, while the body, if you're just sleeping the entire day, would burn 1,500 calories. That means 40,000 steps you have to take for doing the work which body can do in an entire day of sleep. So that much importance is given to the basal metabolic rate which is there, and that can happen in a healthy fashion only if you have a good quality of sleep. And I would say the duration of sleep definitely matters. Even if you are supporting a country which is not India and you have work timings are in after hours, having a discipline and regularity in that particular work fashion would go much better than changing it every third day or every fourth day. That confuses your circadian rhythm, and circadian rhythm is what determines your hormonal balances, and that would lead to a lot of stress inside the body. So if even if you are working at different hours, try to maintain a schedule, try to sleep for 6 to 8 hours of good quality sleep. And definitely social media affects the quality of sleep and the onset of sleep, because people are always preoccupied. The first thing they do after waking up is they check their mobile for messages and notifications. So that kind of a preoccupation, that wherein the mobile becomes our eye opener, is a very advanced stage of addiction to our digital media, and that, if removed and controlled, can help the sleep hygiene go better.
So, what would you suggest that companies and workplaces do? I know that a lot of them are doing several activities for employee health and well-being, and they do motivate them. But what would your suggestions be to workplaces to make it a more stress-free and a more healthy environment for their employees, while of course not compromising on their productivity?
Right. So we do realize sitting in Apollo Eldership Care Center that corporates are very cognizant of it. A lot of major corporates have a dedicated teams addressing and being taking a stock of health of their employees. And going forward, more and more such initiatives should be taken across the lengths and breadths of the corporate world, which would help not only in the efficiency but the productivity and kind of avoiding absenteeism in their work life. Some of the things which the corporate companies probably can take is creating a mandatory requirement of appraisals being done in addition to all the other parameters. Health should be taken as one of the criteria for appraisals and growth inside the company. So that would encourage people to be cognizant that I have a point to lose if I am not doing it in the healthy way. So it's not just burning myself out, but also doing it in a healthy fashion. That's something. The standing meetings and walking meetings can become a norm rather than lunch meets and dinner meets, which probably would encourage a culture of health. It should start with the top down model where the top kind of people in
Man,
top ranks are supposed to be in leading with example, and they should adopt a healthy lifestyle, and that should kind of grow down by just role modeling. Other than this, there should be availability of these kind of blood pressure, digital blood pressure apparatus and sugar monitors in the office itself, so that we see often people say that we were busy in work and so we never checked our blood pressure. And blood pressure is one of the things that we see very commonly being present in these corporate people. So these apparatus being there in their office can encourage them or give them an easy chance to get to know what is happening. The vending machines that these people have in their offices should be full of exemplary healthy choices, so that that not only creates a awareness that these kind of healthy options exist, they also set them in a way that, oh, my system feels much better if I take healthy options, so why should I go for a junk at a later hour? So that kind of a awareness comes up. Apart from this, you can beautify your staircase, put it make it very lively, so that people are encouraged to use staircase for in the office rather than lifts. And the health department should constantly conduct such webinars, and also have counselors in house, which will help them to help the employer to reach employees to reach out and get these counselings from time to time, so that they recognize their problems early and they prevent a burnout completely.
so I think we will have two more questions. So one would be about actual management of several of these heart-related problems. So what what are the, I mean, I know that it's a huge topic, but in a nutshell, for
Yeah.
our viewers, what is available for treatment of some of these major heart ailments?
So I would say that the most dreaded of the problems which everybody is really concerned about is untimely loss due to heart attacks, and somebody calls it cardiac arrest. So not all cardiac arrests are due to heart attack. Some of the heart attacks don't lead to cardiac arrest, which is a condition wherein the heart stops to perform its function and the blood pressure becomes not recordable. That's the state of cardiac arrest. So some of the heart attacks can be dreaded enough to cause cardiac arrest. So one information that everybody should have is how to recognize it based on their symptoms. And the major symptom a heart-related chest pain would have is it's present in the center of the chest, and it's felt more as a heaviness and a sense of choking rather than a sharp pain present in the side. This left-sided sharp chest pains have become a cause of panic for a lot of these young corporate people who consult us routinely, and mainly they are due to anxiety, stress, or acidity. But the central chest pain felt as heaviness are the main type of pain or symptom which patients of heart kind of report as. And these kind of symptoms may be associated with a pain in the jawline. It can be associated with left arm pain, which doesn't go away. And when you try to walk maybe 10, 15, 20 steps, you would feel that these symptoms are getting very much aggravated and you are not feeling better. This particular symptom has to be recognized and immediately attended to. What should be your first line of action? You should go to rest. You should not become kind of start wrapping up your work and all. You should just stop your work then and there, because it can be abruptly dangerous. So you stop your work, call for help as the second response. And once the help arrives, see if there is aspirin available. You drink one tablet of aspirin, say 75 or 150 milligram with a glass of water, call for an ambulance, or arrange for a transport to the nearest center where adequate facility for a proper cardiac evaluation is present. The basic requirements are a facility to a good clinician, a facility to do ECG, a blood test called troponin I, and echocardiography. These four tests are bare minimum requirement for your first aid as well. So such a center you should report to. The blockages in the heart is best removed mechanically, because there are certain blood thinners when, even if it's treated with the success percentage is say 3 out of 10 or 5 out of 10, kind of get revascularization. That too not fully but partially. But the success of a mechanical removal of these clots and complete revascularization is much higher, and the safety is close to 95 to 97%. So depending on what stage of your heart attack you reach. So a primary angioplasty or a stenting procedure is the best treatment for your long-term health, because it's not about pain relief, which may be your acute symptom, but it's also about regaining and retaining your muscular capacity, which gets lost if just treated with blood thinners. So you should probably try and reach out to a center where such facility of advanced treatment is available.
So finally, I'd just like to conclude by asking you to tell us in maybe just a line or two, what message would you like to give to our corporate viewers?
I would say that if one of a few points have to be taken out from this particular discussion, it should be that try and reflect back on your life, try to see and establish a balance, and so that the stress levels in your life can be reduced, because stress is the major triggering factor for heart attack, even for people who don't have a major cholesterol related blockages. So stress, getting into a sudden football match organized by the department, or going for a workout on a day when you have fever, or such kind of sudden events, or going for mountain climbing, trekking, such kind of adventures are meant for people who are meant to do it or have prepped up for doing it. So avoid sudden surges and stresses. Second thing is adopt a healthy lifestyle which is closer to the nature in terms of simple walking and eating fruits and vegetables as your major food, and avoiding junks and sugary items as to be avoided. The third is get tested with the help of a guidance from a healthcare provider, because these when doctors are not involved and you call up a diagnostic center to give you a list of tests, they would do it for various reasons, but they don't customize it based on your health requirement. Neither it's interpreted based on the trends which are happening within the normal range. Your LDL may be 90 before and 120 now, but it's all shown as normal range, and you may not even realize that things are progressing. So try to take help of a healthcare provider when you're choosing your health checkups, and definitely include treadmill test as a part of your heart workup, because that's one test that predicts your future heart problems, and ECGs reports are not sometimes sufficient. One should know that there is a test called CT angiography, which is there, which can predict and identify blockages of even 20-30% and help you improve your lifestyle at that stage. So this is also something that can be done once in 10 years to know how the health is going. So that in a gist is probably what I would like to communicate.
Thank you so much, Doctor. Thank you, viewers, for joining us today. And I do hope that you found this session useful and informative. Let me also end this session with the key takeaways, which are: recognize stress and signs of burnout. If those signs are there, the worst thing to do is to try to tough it out or rough it out. Lots of people think that they just have to push, and it is weak to admit to any such signs of distress. We are not invincible, so don't shy away from seeking help from professional therapists, and swap out burnout for inner balance. Embrace daily rituals that support sustainable habits, and look for positive coping strategies. Delegate tasks at work, take short walks during the day, eat healthy, take periodic breathing exercises. Remember that nothing is worth compromising your health. Nothing is worth poisoning yourself with stress, anxiety, and fear. See you soon next time at the next session. Thank you and namaste.